organic garden. I should say my wife's because she's the one who does all the hard work. But when I take it from her garden, it has a really unique flavor and taste that I might not find from a more commercially grown product somewhere else. So real food, including wine specifically, has a tradition of what we'll call terroir. And that's a French word that simply means the taste of the land, the area that it came from. So with that kind of background, and if you haven't listened to the December and January webinars talking about mindfulness, and we walk through some mindfulness exercises, I encourage you to do that. If you did and you forgot about them and you want to start that for the new year, they're available on YouTube, and we've got links and things for those on the website as well. So Brianna, if you could put that first slide up for me, I would appreciate that. And we will get started by going back in time a little bit. So one of the questions is, well, where did all this information or these ideas about, wine potentially having some health benefit come from? And really, if we're talking about kind of the modern age, we have to go back about 30 years. And I want to talk about a study in particular that really kicked off this idea that wine, particularly red wine and other things that we'll touch on, could have health implications. Because I certainly remember back in medical school being taught that alcohol consumption was something that people did socially, but really did not have any kind of redeeming health value. And yet here we are today talking about potential health benefits of red wine. So how did that really happen? Well, in the early 1990s, so we go back about 30 years ago, there was a study published that listed 27 industrialized countries and looked at their death rates from coronary heart disease. And the country that did the best job in terms of low rates of cardiovascular disease was Japan. And people said, wow, that's what we've been telling you. Of course, that makes sense, right? The Japanese, it's an island nation, so they eat a lot of seafood. They don't eat a lot of red meat. They eat a lot of carbohydrates in the form of rice. And at that time, those were the recommendations. They said, see, it was like, see, man, here's the proof. The proof is in the tasting of the pudding. Here it is. We're coming right at you. Japan, look at what they're eating and look at what we're telling you to eat. And boy, is that spot on. And then we went to number 2 on the list. And that's France. And you say, France? Hold on, wait a second. What's going on here? And this second place finish by France was not some sort of shabby, way down the list kind of finish. At the time, the French had over 50% reduction compared to the United States in the incidence and death rate of cardiovascular disease when we looked at middle-aged men. And not only that, French women outlived everyone, and they actually had fewer heart attacks than their Japanese counterparts. And when we looked within regions of France, what was really fascinating is the very lowest rate of cardiovascular disease was found in the southwest region of France. Well, that's where they don't use a lot of olive oil. They eat a whole lot of foie gras, which, if you don't know, is that fattened goose liver. And foie gras is where they raise it, where these people eat it more than anywhere else in France. And foie gras was essentially the poster child for everything that you should not eat that was being told to people in the United States at that time. Next slide, Brianna. And not only did they eat a whole lot of foie gras, but the French eat more butter and consume more wine per capita than anyone else in the entire world. And that's still true today, 30 years later. And they serve that, the foie gras and a glass of wine and a pat of butter, with things like egg yolks, pork, cheese, sausages. So it's not like they're just having, foie gras in a salad. So they're really eating a lot of the things that for a long time have been shunned as foods we should avoid in the United States. And when we look particularly at wine consumption, what we find is just in sheer volume, and this is recent data from just within the last couple of years, in terms of production and consumption, the French are only second to the United States in terms of absolute wine consumption. When we look at it on a per capita basis, they drink about 10 times more wine than the average person in the United States. And so these anomalies in the consumptive patterns of the two different countries, well, that became kind of areas to explore for what became known as the French paradox. And one of the things which was observed, and we find this, and we talk about this in our course because we address sort of these outliers, because whenever we do good science, there's always sort of outliers in any data set. And when we do good science, those outliers should make us think and make us question our hypothesis and go in search of those answers as to why that is. And so when we look at the French paradox, what we find back 30 years ago and still really true today is that one of the big differences in the French diet compared to the US diet is that they eat significantly less ultra processed and highly processed foods. Next slide, Brianna. And so this is something that is of note, not only in the French paradox, but in things we might call the Inuit paradox, and so forth, kind of across the globe. And what's really interesting, because we hear so much about fat, which was really derided for so long, because we were told that fat makes you fat, fat gives you diabetes, eating saturated fat raises your cholesterol and you have a heart attack. Well, the French, with these low rates of cardiovascular disease, in the amount of cheese they eat, which is about 40 pounds a year, just their cheese consumption, they've consumed more saturated fat than the US recommends from all dietary sources combined. One of the things that they consume a little less of than the US is the things like sugar, etc. And excuse me. And certainly one of the things is that as they're having their wine and as they're having their eggs, they're certainly not skimping on the carbs, because the French enjoy their bread and they eat more bread and more taties, potatoes, than we do as well. So it's certainly not a difference in folks doing a keto version. The French paradox is certainly not being equivalent to the keto diet. Next slide, please. So what folks did is they said, gosh, we can't explain this, so challenging. So let's challenge the study. And this is great. So what they did is they looked to find problems with the study. And I can tell you now that this study's really been put to the test and been replicated many times over. But so one of the things that they did was they said, well, the French are the French, right? Maybe they're different. Maybe it's just, they're all descended from the Gauls and they have some incredible metabolism that would explain these. And that turned out to be false. That was a fail, because they're a very heterogeneous population. They're not homogeneous. And they said, well, maybe it's the calories, right? They might be eating foie gras and butter, but maybe they got less calories. And it's like, no, that was about the same as the United States. And they said, well, maybe it's the cholesterol levels. And it's like, no, given any cholesterol level, the French were only 50% as likely to have a heart attack. So that's really reduced rates independent of what your cholesterol level is. And they even went so far as to say, well, maybe the French are just kind of, not really with it. Maybe they don't do good research. Maybe the French are kind of stupid and they don't know how to tell when a person's dead. And so they actually went back and they reviewed all the death certificates to make sure that the coding was up to snuff, and they found that it didn't make any difference in the outcomes. So the term the French paradox really became a true paradox. Next slide, please, Brianna. And why I bring this up 30 years later is that to date, No one's been able to explain this. So if you ask somebody who's out there telling you, you can't have saturated fat and you better not have a glass of wine, and you say, well, excuse me, what about the French paradox? You sort of get a, well, whatever. And, shrug of the shoulders and move past it. And what's very, very important is that the points that were raised in a study 30 years ago just have never been explained away. They've been replicated multiple times. And yet the attitude towards the data is one to kind of sort of shrug the shoulders, push it in a corner, and just kind of hope it goes away. And that's something, these types of findings are things that we talk a lot about in our culinary medicine studies, because these are important. We have to go where the data, where the data sends us, not where we want to go because we have a predetermined agenda. And one of the things that stands out from the French paradox is this idea of wine consumption. And that's why Dr. Willett of Harvard School of Medicine, talked about that back in 1991, saying, well, really, when we look at things like the French paradox, from an epidemiologic standpoint, this wine consumption, this alcohol consumption is something that's really one of the few variables that's really stood out and stood the scientific rigors. Next slide, please, Brianna. And so that kind of brings us to talking today based on the results of that French paradox study over 30 years ago, to look at, well, what are the facts about wine consumption today? What do we know? Well, again, a lot of people don't want to talk about this. They don't want to tell you this. They don't want to publish it. And even amongst, healthcare professionals, for the idea that, somebody's going to go out and have a glass of wine and said, well, Chef Dr. Mike told me I need to drink wine for my health. And first and foremost, that's not what we're saying here. So if you don't drink, taking up drinking for health reasons is not encouraged. Let me be clear. Don't pick up a glass of alcohol because you think, you're going to get an important health benefits. There are other ways to do that. But for folks that do engage in moderate alcohol consumption, and that's over half this country, we should know exactly what the risks are and what the potential benefits are as well. And so first off, we'll be talking about what's called a J-shaped curve, which kind of looks more like that Nike swoosh that in the Just Do It commercials and ads. And what I mean by that is to say that at a certain level, the more you drink, the more adverse and bad health impacts are going to become manifest. So at some level, drinking more is always, a bad idea. And so what we're talking about when we talk about moderate wine consumption is finding that sweet spot. In terms of cardiovascular health, what we find is that moderate wine consumption is associated with about a 30% reduction, which is pretty substantial when you look at the benefits of things that we prescribe, like aspirin, like statin medications, etc. Wine consumption seems to be on par in terms of a protective effect with regards to heart health. And the other important thing is this is not something new. It looks like at least for about 50,000 years, human beings have been consuming one form of alcoholic fermentation or another. Next slide, Brianna. And as I mentioned, we have over 50% of the population in this country engages in what we call moderate alcohol consumption. And I talked about a 30% reduction in cardiovascular events, morbidity and mortality. What does that mean? Well, let's just think about it, because in the United States and many industrialized nations, heart disease, what we're talking about in the month of February for Heart Health Month, again, the Go Red for Women Heart Health campaign, think of 3 people Just take a moment and think of 3 folks that are close to you. One of them will die of heart disease. So that's how prevalent it is. It's responsible about 1 in 3 deaths. When we look at some of the data sets that we saw in the French paradox study in terms of the wine consumption and the cardiovascular benefit, well, we start to see the same effects in northern Spain, Spain, a Mediterranean country, Mediterranean diet, northern Italy, Italy, Mediterranean country, Mediterranean diet, also Austria and Switzerland, where they have high levels of saturated fat consumption, but low rates of cardiovascular disease. Next slide, please. And in 1979, there was a landmark analysis from the Cochrane Group. Now, in terms of looking at health-related data, Cochrane analysis are what's considered a gold standard. So they do a really, really rigorous job in terms of looking at meta-analysis, pulling the data together. And they're also very independent. So you can get a very good independent assessment of what the data is telling us. And again, 1979, they looked at 18 countries, which included, outside of France, Italy, that I mentioned, and found that wine consumption correlated with low rates of cardiovascular mortality. And in fact, total alcohol consumption, as one might surmise, as these are big wine drinking countries, also correlated with reduced rates of cardiovascular disease. And just kind of as an interesting aside, in this country, the very first study that was done, prospective study looking at the health effects of alcohol consumption, was actually done in the 1920s in Baltimore. And demonstrated that, again, what's been replicated time and time and time again, moderate consumers have an improved cardiovascular survival compared to people who don't drink at all, or compared to people that are heavy drinkers. Next slide, please. And what exactly is a moderate drink? Well, that turns out to be about 1 to 3 drinks per day. Binge drinking, on the other hand, is associated with a significant amount of cardiovascular adverse outcomes. So we don't recommend that under any circumstances. And there's a whole bunch of different mechanisms that people talk about. But here's the end game. We don't know why this works. We don't know why this correlation is. We don't know the exact mechanism. People have tried to put things like quercetin or resveratrol into chocolate bars and say, now you're going to get lots of this, antioxidant compound like found in wine, but it doesn't seem to bear out in terms of the protective effects. So the sum is, we don't know why it works. We don't know why this correlation is, but it's clear that it is there and it is real. Next slide, please. And so I know I've taken up a lot of time, but I want to sort of sum it up with this slide here. This actually comes from the National Institutes of Health publication and shows you kind of this J-shaped curve that I was talking about. And when we say 1 to 3 drinks a day, again, what is that exactly? Because I have an awful big wine glass. What we mean is the average pour, and that's about 5 ounces of wine, around 150 milliliters. And as you can see on this graph, they're talking about grams of alcohol a day. So that one glass of wine, that 5 ounces, generally correlates to about 14 grams of alcohol. And so we could see if you look at 0, which is somebody who abstains from alcohol, and we say their risk is a 1, that there's a drop and sort of a sweet spot at somewhere between kind of 1 to 3 drinks per day in terms of reducing your risk for cardiovascular disease. Okay, you could take that slide off, and I want to wrap up real quick and make sure that we get to Doug. And so this is something that's been found. There are kind of 7 of these blue zones that I talked about, and in 6 of them, some form of alcohol consumption was part of these folks who lived to be over 100. That was part of their daily regimen. And in Sardinia, they did a really good job with this particular grape, which is native to Sardinia. And again, what's really interesting about this native version of the grape that they grow there is that it has very, very high levels of antioxidants, which you probably heard about. Again, consumption of those are associated with health. And the Sardinians like to drink a lot of it. So with that in mind, I want to see if we can get Doug in, if he is still here, to tell us a little bit about this wine. So the next time we have a glass, we can approach it mindfully and really connect to the grape in the vineyard. Doug, are you there?
I'm here. Can you hear me, Mike?
Yeah.
Okay, good. How's it going?
Great.
Okay, you ready for me to start, Dr. Mike?
Yep. Yeah.
I have the same bottle as Dr. Mike, Canino di Sardinia. It's spelled Sardinia, which is Sardinia in Italian. You probably already know, everyone on this call, that Sardinia is an island in the middle of the Mediterranean, and it's a very remote and rugged and mountainous island. It's been settled over the centuries by various groups, including the Phoenicians, the Byzantines, the Arabs, the Romans, the Catalans. So all of these things have come to influence modern culture in Sardinia. They have a local language called Sardo, which is a blend of Italian, Spanish, Basque, and Arabic. So it's a very unique sort of place. And the Canino native grape that Mike has referred to is actually influenced by the Spaniards. It's the same grape, it's a clone of the same grape, as we call it in the wine world, as Garnacha. And Garnacha originated in Spain. It's the same grape as Canino in Sardinia. And in France and the rest of the world, it's simply called Grenache. So it's a big, flavorful, full-bodied wine that's terrific with a lot of things. As a matter of fact, Heather and I had this wine just last night with pasta and steak, and it's terrific. And it's also not expensive, which is a nice thing. We sell this at Missoula Wine Merchants for $23 a bottle, and I would call it an excellent value for that. And one of the things that Mike's been talking about a lot, obviously, is the benefits of red wine. And so why do we hear so much about red wine as opposed to white wine, beer, spirits, etc.? And one of the things I learned when I was studying for the certified sommelier exam and reading big, thick books like the Wine Bible, which I have in front of me, it's about 1,000 pages. And there are properties in tannins in red wine that lead to health benefits. And red wine, as opposed to white wine, as opposed to beer, vodka, anything else, has tannins. What are tannins in wine? It's a sensation, it's not a taste. And it's the sensation of astringency, of you puckering at the end of a glass. So you take a sip and it comes out really dry and it makes you pucker up and like almost a wool sweater sort of feeling. That's the experiment of, or that's how you feel tannins. Where do tannins come from is they come from really mainly three things. They come from the grape skins, they come from grape seeds, and they can come from oak, in which wine is fermented and or aged in. The most important of those for our purposes is the skins of grapes, because red wine is fermented with their skins on. Red wine, they take the skins off before fermentation, which is one of the reasons you can have a red grape but make a white wine out of it, because the skins are what gives the wine that color. So you take those skins off, all juice of grapes, whether it's a red or a white grape, is clear. So the reason that red wine appears red is because of the skins. Yes.
Doug, I just wanted to remind you we need to wrap it up. So maybe just one more moment or one more thought.
Does anyone have any questions? That's really all I had. that was an easy wrap up, wasn't it?
Yes.
Dr. Mike, anything else you wanted me to address in that?
No, I think that that was really helpful, Doug, and that's great. And folks, again, if you want to go back and look at the webinar from January where we talked about having a coffee, tea, or a glass of wine, and maybe we'll have you take us through a wine tasting next time, Doug, because I just see that that's such an exercise in mindfulness to really connect to that vineyard, really connects us to the earth. And that's a simple way to incorporate a mindful eating practice in a delightful way when you're enjoying the wine by really, transporting yourself to the vineyard, being there, feeling that sunny Sardinia, rocky gravel, vineyard, feel that grape, see it growing, all those things. So that was really wonderful. I apologize to everyone that we did not, I knew this was action-packed today, that we did not get to some of the questions. If you want to just submit them to the website, I will get back to you with those answers. I promise. Just give me a day or two. Always depends on my call schedule, etc. But thank you so much for tuning in, Doug. Thank you so much for giving us the info in Sardinia and how to pronounce the grape, which I would have mangled. So that was great. And thank you all for coming today. And I hope to see you again next month when we, snack and chat at our practical culinary medicine webinars. Thank you.
Bye, everyone.